Order. Thank you for being here for the special meeting of the school board based upon our discussion on Monday evening about addressing possibly a change in quarantine. Last evening, Tuesday, we posted the language. We received over 50, I believe, Let's Talk communications on there, as well as several emails to us. Tonight, we have first public input. We have 3 who are signed up in opposition. We have 15 minutes for each side, so since there's only 3 on the opposition, they will each get 5 minutes each. And then we have 9 supporting the administrative recommendation. Normally that's 15 minutes as well. I'll just round that up to 2 minutes each for 18 total. But if people come up here and you've already heard what you wanted to say, you could just say, I'm ditto that and so forth, and you don't have to use the full time. I hope we all behave better than what we saw on TV last night. I expect that. So
no interruptions.
Yeah, exactly. No, I won't interrupt you until your time is up. Karalee here will be monitoring the time, so when you have a minute left, she'll kind of give up a hands up, and then when you have 30 seconds left, she'll do the same. When you approach the mic, please say your name and your address. That's not counted against your time, just so we have it for our record. Saying nothing else, should we go ahead into that? So we'll start in opposition. I'll try to say everybody's names correctly. We'll start with Molly. Geary, would you please come up and speak and state your name and address? Thank you.
Thank you. Molly Geary, 3613 West 85th Street, 204 Sioux Falls, South Dakota, 57108. Thank you for having me here today. I'm here on behalf of my wonderful colleagues I have the pleasure of working with daily. Honestly, many are afraid to speak their mind on this issue for fear of backlash. However, I teach my students to speak up for themselves, and it's time for me to practice what I teach. I am here today to voice concerns regarding the proposed changes to the Return to Learn plan. My first concern, why fix what is not broken? I mean, if it is true that we have low numbers of COVID, which is not well known given the lack of transparency the district has provided regarding cases in school, those numbers are because the plan is working. It does not appear to be a desirable goal to keep relaxing the plan until we find ourselves with too many sick kids. My second concern is the lack of educator voice throughout the entire process. The district put a committee together over the summer that did not represent the feelings of the entire district. When the mistake was realized, the district sent out a survey, which the results showed about 2/3 of district staff wanted masks in school to be required. Regardless, this board decided to allow unmasked students into our classrooms. Yet somehow teachers have become the villains in this chaos because we are asking for safe working conditions during this global pandemic that has killed 1 million worldwide. School has been open for a month, and my colleagues and I are already at the point of exhaustion. This leads to my final concern, which is adding another thing to a teacher's long to-do list. Please let me be clear. These changes will pile on more to our overwhelming online and face-to-face workload. Because of this change, teachers will now have to track individual students and whether or not they're wearing masks correctly every day. Let me put that into perspective. I have almost 150 students daily. Because of this change, teachers will now have to track individual students. Do you realize how much you're asking students to cater to the students who actively decide that my health and that of my colleagues isn't worth a small inconvenience? What about the mask exemption list? What about the hallways? What about outside and close groups? Are we supposed to monitor and remember who wore what and when? We're already struggling, and the district has provided no support for teachers to deal with the workload. If you put this change in place, you will need to provide mental health support to meet the needs of your staff. If you put the change in place, you'll have to do something to help us with this insane workload. If you don't, it isn't just reckless, it proves we're not in this together. Thank you.
Thank you. Sorry, she had the wrong timer set. Sorry about that.
Sorry, Molly.
Next up, Jennifer Burgin Gabor, would you say your name and address, please?
Jennifer Burgin Gabor, 6432 West 56th Street, Sioux Falls, South Dakota, 57106. And first of all, I'd say, hello, it's me again. I know some of you are probably getting tired of hearing me, but as Molly said, we have staff members in this district who are in fear of retaliation. I'm not. I'm not afraid at all. This isn't about RHS staff members. This is about staff members district-wide, because I have been contacted by multiple staff members. You need to be aware of that. It's just that we're the ones that are speaking up, all right? I truly understand wanting to make some sort of change to decrease student absence. I absolutely understand that. But I counted today, because I have 143 students, and I counted 34 of them who did not wear their masks correctly. Now, do I have to do that every day now? Is that something I need to be concerned about to add to my list? That's 23.77% of my students. So for you to be told that 100% of students are wearing masks is an out-and-out lie. It's a lie. And I'm here to tell you those are my numbers. You gave us less than 24 hours to see this new language, to have discussions, and to come here and talk to you about it. I have talked to people at all levels, administrators, et cetera, and some of them weren't even aware as of this morning that there was a language change being discussed. How am I to go to my administrator to get support when he doesn't even have the information in front of him? This is ridiculous. It's abhorrent. The communication has been nothing but pathetic. We have been left out of the loop, and frankly, I'm tired of it. I teach kids to communicate, and they do a better job. I have kids constantly emailing me that have been on quarantine, and they are getting the information they need. I am Google Meeting with them, I am emailing them, I'm doing what I need to do. Is it extra work? Yup. Am I okay with that? Absolutely, because I want them to be successful. So do my colleagues. The sad part is that somebody yesterday removed a post that somebody had put up from a parent that said they wanted to show up at tonight's meeting with signs that said, F teachers. This is what we're dealing with on a daily basis. We're hearing it from their kids too. The disrespect has got to stop. We don't want our kids out of school. We don't want them sick. You talk about the number of COVID kids, of the quarantine kids who haven't been tested positive for COVID, but nobody's being tested. You can tell me they don't have symptoms, but I don't know that. I don't know if the parent's telling me the truth or not. I've had students in my 28 years come to school practically on their deathbeds because mom and dad wouldn't let them stay home. There are parents out there, are they all like that? Absolutely not. We have loving, caring parents who will take care of their kids. But the bottom line is this: if you make these changes now without input from staff, without input from all sorts of people in the community, then you are taking the word of a few people because somebody called in and complained because little Johnny and little Susie didn't get to go and play in their game last week. You need to think about all of us and how safe it is or isn't in our classrooms. And right now, Roosevelt has had one amazing go of it. We have systems in place. I have not had a ton of students missing. Why? Because we have systems in place. If what we're doing is better than what others are doing, then let's start doing that in the other buildings so we can start bringing things backwards, so we can start loosening up a little bit. But I don't think we're far enough into this to know. And the numbers in the community keep rising. If they're going to keep rising, that's still coming into our buildings. We have too many people who have illnesses in their family. They have children they're trying to take care of. They have all of that. I have a little girl that I don't want in the hospital. I don't want myself getting sick. This will not take care of those of us with special needs and special issues. It's looking at whether or not the kids are uncomfortable with it and whether or not the parents are unhappy with it. And you have to look beyond that. That is your task. And I thank you.
And finally, Tim Eckhart, please.
Good evening. My name is Tim Eckhart. My address is 2312 South Holt Avenue, Sioux Falls, 57103. Thank you for allowing me to speak this evening. I knew we'd be having a conversation to modify the R2L, but I didn't think we'd be having this conversation this soon. We've only been in school for about 23 days, and we've only had 23 days of data to really go through in order to make this decision. Usually when we make decisions this drastic, or this big, we usually take more data, more time to make this decision. 23 days doesn't seem quite like it's enough. The proposed changes create 4 variations on how schools should respond to close contact in school. SFEA is asking for you to make this process easier to understand by requiring masks in our schools. As asserted in your policy change, masks make a difference. And instead of needing 4 variations for staff to help determine which type of monitoring students or staff would need, the district would only need 2. You're infected, you stay home. You're a close contact, wear a mask, you're at school. This decision, again, makes that process easier for parents, staff, and students. In the Sioux Falls community, COVID cases are clearly on the rise. The city's website shows an increase of infections. Today alone, we saw a 70% rise in infection versus yesterday. Not a trend we want. The infection rate is up 10.5% over the biweekly average. Moreover, hospitalizations are almost up 20% against the biweekly average. We know that this whole process has not been easy for anyone. But we also know that our incredible staff has had to bear the brunt of the challenges facing us during this unprecedented time. Whether it's having our daily schedule changed 6 times in the first 4 weeks of school, or having to disinfect extra surfaces in addition to cleaning rooms at the end of every day, or to act as a nurse in the office instead of being able to do the job of helping make this building operate more smoothly. Teachers and all staff have been busting their butts for under unforeseen conditions, doubling of duties at the elementary level, being asked to record, edit, and upload lessons in addition to teaching their regular in-person classes that aren't socially distanced. We know, I mean, if you've been in the classrooms, you know that that's the case. There are some that can do it, there are others that are unable to. They're doing more work, but are not seeing an increase in compensation. The staff members in this district are working harder to provide the best education to our students than ever before, all without a pay increase. 59% of teachers in the district last year did not receive a pay raise from last year. 59%. Even though our district saved $631 approximately per student. The emails of thank yous, they're great, but they only go so far for our staff members. As was already stated, it's wearing thin. They're getting stressed out. You go in the schools, you can see it. It doesn't take long to notice. So if you're going to make this change, which we know you are, then require masks and go that extra step. Go the necessary step. Thank you.
Thank you, Tim. We'll move on to the other side. Reminder, this will be 2 minutes each, and Carly will continue to give you notification. First, we have Brad Newt, please.
Thank you. Brad Newt, 6800 West 64th Street, 57106. And I'll address the board today. I am a teacher at Lincoln High School. And just to give you, I guess, my perspective of this is, with the current policy, I feel like I've been under a lot of stress because of the current policy. I've had, at one point, 30 of my 120 students out on close contact quarantine. And that obviously impacted my classroom significantly, having almost a fourth of my students learning from home while I was trying to teach the rest of them in school. I feel like the students at Lincoln High School, for the most part, have done a really good job wearing masks. I think we've sent a mixed message to them because they're following what we're asking them to do, but yet, by luck of the draw, some of them have been asked to stay home for 2 weeks based on solely who they happen to be sitting next to in a class that maybe test positive. I appreciate that you guys, the school board and the school district decided to start the year cautious. I think that was a wise decision in my opinion, but I think we're a little bit ways in now. I'd like to see us loosen things up a little bit. I would like to see us, give the opportunity to students who are wearing masks, who are labeled close contact because of where they happen to be in the school, a chance to still come to school, to receive an in-person education, monitor themselves, as you guys have stated, and still be able to learn in person. I think that would really help things. I appreciate you guys being willing to take this up. This is obviously a really tough thing for us to decide because we're trying to balance health and community with what's best for our kids educationally. I would just like to see you maybe tip a little bit more towards letting these kids stay in school. Thank you.
Thank you, Brad. Next, Alice Wilson, please. Would you state your name and address?
Hello, everyone. Alice Wilson. Address is 3144 South Tyler Court, Sioux Falls, South Dakota, and it's 57103. I wanted to bring to the attention a case, and I'm going to use my daughter as the exact case. She is a high school student, so I'm speaking on behalf of having a high school student. I also have 4 other children, just as an FYI. As a parent, you always try to use those best practices when you send a kid to school or not send a kid to school, those types of things. In my count, with high school at Washington, there was 22 days of school so far. Ella has had 2 close contact encounters and has missed 15 days of school. She was a 4.0 student. She currently has 2 C's, 2 D's, and an F. We did not sign up for online learning. She is very social, and I would say that maybe even from a mental standpoint is going crazy being at home. It was her first day back today. She participates in 3 different sports for fall. She's had to miss multiple events, which causes stress on the team, and let alone the coaches, those types of things, who are already dealing with what they're dealing with in the classrooms as well. I brought a lot of different examples. I have a sister that works in the healthcare system, and their policy with close contact is if there's no symptoms and they mask, they're still going to work and caring for people. So when I think of the demographic of a high school kid, it just, to me, it seems like we should loosen the policy. I think of a comment that was made to me, having a kid out. I was asked if I was wearing a scarlet letter because my kid caused all this problem with their sport. I think people are lying about having symptoms and getting tested because of the way that the policy is. And I think if we change it, it would allow maybe some more accurate things happening in school. So, thank you.
Thank you, Alice. Next, we have Dr. Carrie Holtgren, please.
Hi, I'm Carrie Holtgren. I'm a family practice physician in Sioux Falls, 2323 South Main Avenue in Sioux Falls, 57105. As a family practice physician here, I can tell you, I can echo that, and I've spoken to over a dozen healthcare or other physicians, mid-levels, and administrators in the last 24 hours who also kind of echo my sentiments here. That yes, she's right, as close contact doesn't count if you're both masked. And so I would also echo that we do like mandatory masks, but for now, it is safe to let these high school these students 0 to 9. The numbers are very small, so elementary is very safe, and 10 to 19 is also staying very stable. Those numbers aren't dramatically going up. The biggest numbers are 20 to 50, and so we know that masks work. The science behind that is obvious. And so I think we need to give our diligent maskers the same respect that we give medical professionals and the same ability to stay in school and learn in person, face to face, because it's safe, and we know that. And we just haven't seen the numbers of quarantine kids come back positive at all. And I also agree that it will hopefully incentivize people to be more truthful in their symptoms and getting tested so we can actually contact trace the virus even better. And then that will help our city. Thank you.
Thank you very much. Next, Summer Hoffman, please.
Hi, Summer Hoffman, 4604 East Alpine Circle, Sioux Falls. I echo what Alice said, as I also have a son that was just returned to school today, and much the same way. He missed 3 tests. He missed a couple of physics lab, if he takes Spanish 4, which really does require to be in class to do your presentations. So I, again, echo what Alice said. My biggest concern is he has already expressed anxiety of this, he could pull me out anytime. I mean, he says, I can go back for a week and they can pull me again. And that is causing my son stress. He's a teenage boy, and he's a pretty average teenage boy. It's hard to keep him focused when he's having to study at home if I'm not there watching him, making sure he's doing it. And I work full-time, so that's certainly not feasible for us. And they're doing what he's being asked to do. He's wearing his mask. He's limiting his out-of-school social gatherings. And when he's doing what he's asked, and then he still gets sent home, missing class, missing sports, missing activities, missing his friends and his teachers. He loves his teachers. And he benefits from being in class. So I would really like to see the requirements loosened as well. That's all I have. Thank you.
Thank you, Summer. Next, we have Amy Heiner.
Hi there, my name is Amy Heiner, and I live at 3901 South Bedford Avenue. And I have a 7-year-old who is a first grader, and I am a librarian at Harvey Dunn Elementary. And I am in favor of ending the close contact 14-day quarantine. Our kids have been wonderful about wearing masks, and it feels so amazing to be back in school. I see 600 kids in a 4-day rotation, and I'm just, again, very impressed with their mask wearing. They're following the expectations we have for them, and yet they may be quarantined. The policy change would only increase the incentive for students to wear masks because they want to be there. We have not seen a ton of close contact quarantine situations in the elementary like high schools and middle schools have, but I have many friends with middle school and high school students who, again, their kids are on their second quarantine and are just devastated. They're wearing their mask. And I just think the message that we're sending is you're doing all the right things. We've seen the research on mask wearing, but you still have to miss 14 days of school. Personally, and I know it's not just about me, but my 7-year-old has been so motivated at school this fall. And I just think the message we're sending is that even if you're doing the right thing, you're still getting sent home. And one case can knock out, like in the high school, up to 30, I'm just thinking about their classes, up to 30 kids. So thank you for your time and consideration and all that you do.
Thank you, Amy. Next, we have Karalee Lee.
Karalee Lee, 2205 South Roosevelt Avenue, Sioux Falls, South Dakota 57106. I have 2 daughters in the Sioux Falls School District. Neither of them have been diagnosed with COVID, and neither have been considered close contact. So why am I here? I want to tell you some stories of some of their friends who have been sent home. With the new COVID policy, we are now allowed to transport our own children to and from events. My husband and I have taken advantage of this new rule, but not every kid's parents are able to drive them. Some of my daughter's friends were on a bus, masks on, windows wide open, but they were sent home because a student on the bus tested positive. Before these students were sent home, they were afraid to take rides home from their friends and walked an hour and a half to get home in 90-degree heat. The next day, one of my daughter's friends was sure he was going to get sent home and didn't come to school because he didn't want to make that walk again. He was not considered a close contact, and he missed a day of school for nothing. These stories are unfortunate, but what is really unfortunate is the students who are on free and reduced lunch. How are they eating? If school lunch is their main meal, how are they doing during a mandated 14-day quarantine? What about the students who have therapy at school, or the student who needs a nurse to help dispense their daily meds? Vice President Ryder said it well at the school board meeting on Monday. The school system also provides services and safety to kids in other ways. Board members Tolkien and Parker said this document is living, meaning that it can change. The numbers support a document that gets rid of the mandatory 14-day quarantine. If the numbers change, then we revisit this again. Thank you for allowing me to speak on behalf of the students who might not have someone in their corner.
Thank you. Next, Jill Madsen.
Hello, Jill Madsen, 2101 South Firestone Lane. And thank you again for letting us speak tonight. We really appreciate all the school district has done to get us started in the conservative approach that you've taken. But we do feel it is time to relax the regulations a little bit. We've seen the numbers, they've come back, and they show that masks do work. And I believe that if we allow our students to wear their masks, and if they're wearing their masks and they're not getting the close contact, that it'll encourage them to wear their mask while they're in school. You know, many of these students are being called out for a second time, and I think the anxiety of that phone call from the school is hard on the parents and hard on the students. So anything we can do to keep them in school. During a normal school year, if a student misses more than 10 days, that's considered, you know, that there's academics are in jeopardy. And here already, so many students have already missed 10 and 14 days of school, and we're only 22 days in. So we appreciate your consideration. Thank you.
Thank you. Joni Merkley, please.
Hi, Joni Merkley, 1608 South Williams Avenue. And we have 4 kids. One son just graduated out of the Sioux Falls School District. And we have kids elementary. This is our first year in 7 years not having a middle schooler. And then we have 2 in high school. And I want to go off of what has been said too about kids that don't have a voice. We have a good, healthy, happy home life, involved parents. I was able to quit my job last March in anticipation of how school would go this year, so I would have more flexibility. And when our daughter was quarantined as a close contact for 2 weeks, you know, I was home with her, we were having fun, grabbing Starbucks occasionally, cooking together, doing things, and I could still just feel just that anxiety and depression setting in. And when I asked one of the administrators, she had texted me to see how Ellen was doing. And when I said, you know, I'm a fun mom, like how are kids in these difficult home situations doing? She said they're fading. And I just, I've seen it in my own kids. And again, they have positive things, people that support them. I think we just really need to think about kids that don't have someone here tonight, giving them a voice. Thank you.
Thank you, Joni. And last, Kim Shetton, please.
Kim Shetton, 5109 South St. Andrews Circle, Sioux Falls, South Dakota, 57108. Ditto, 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 ditto.
Thank you. We appreciate the brevity. We will move on then to Dr. Stavum and presentation of the language.
Good evening, everybody. I'm gonna take off my mask while I'm at the podium. Thank you for your time this evening, and we just want to extend our thanks to everybody who came to speak. We also appreciate the public's input on Let's Talk and the many emails that we've gotten. I think one of the most difficult things that we face as a school district, which is true across the nation, is that school districts are a unique entity where we are looking after both the well-being of our students and the well-being of adults. And having that combination always makes things a little bit more difficult. And so the change that the board requested to review in language is something that we would apply to both the adults and the students in our district. And just to be as clear as possible, this is one piece of many things that are still very much in place that we are altering in order to solve a very specific piece that has emerged since even the beginning of school with the number of students who are out on quarantine. So I want to be clear that we are not altering much of anything in our entire plan because we have great protocols that have been put in place. We see time and time again when we are out in schools, all of the things that our teachers and administrators and our staff members have done to put layers in place. And one of those layers is a mask. We have plexiglass, we have spacing, we have hallway protocols, we have hand sanitizer. I saw it today in 3 schools. And our kids and our adults are doing a beautiful job under very, very difficult circumstances this year. So there is no doubt we all feel the strain over time of having school, having life during a pandemic. So that can't be understated. So specifically tonight, in the revised document, the change would be essentially if there is mask-to-mask contact in a school setting, the quarantine 14-day period would become recommended rather than required. That's very, very limited to that school setting. If there is still a case in the home, the quarantine would still apply. If both parties are not in masks, the quarantine would still apply. If anyone is symptomatic, the quarantine applies. And so this is a very narrow piece of this guidance. And so I would be happy to answer questions or call upon my colleagues, which I might need if it depends on the question. But I just want to be very clear that that is the strand that we are looking at altering. We are not saying anything different about expected masks. In fact, to come back from that quarantine, you would be expected to wear a mask or you would need to quarantine at home. So all of those good practices that we have in place right now would stay. We had talked about this on Monday night. One of the things that we've heard from students directly, the adults have reiterated some of that tonight, but we've heard directly from students that they are beginning to wonder about the why. Why am I wearing this? Why are my friends wearing this when we're not seeing how this matters? So I think it's important to think about that. But we did say this is a living document, and we would continue to monitor the numbers and the community and looking at that. So I also think we need to make that very clear. Questions or comments from the board?
Well, first of all, thanks for those that came up in front and spoke what is very near and dear to your hearts, and it certainly is to ours. And this is not something that we have just made a willy-nilly approach to change this particular piece, the social, the close contact and the quarantine policy. But we've really looked all along at a true data-driven approach to getting kids both back in school and keeping them at school. And we know that based upon those numbers, at this point we are winning due to the mitigation tools we're using, the masks, the social distancing, the hand sanitizer, the shields. We know that because we have 0.1% of the students that have tested positive, and we have 0.3 of the staff, and we have 0 hospitalizations. So we all should feel, we should really hold that up and be, that's a success. And we should feel that and know that. And due to the current policy, though, in terms of the close contact and quarantine, those numbers look remarkably different. We have 5.2% of students out and 1.47 staff out. They're at home. So students with no symptoms absolutely should be at school, given that what we are hearing back from a data-driven approach that there's very low risk. That's well documented. And it's also well documented the stress, both financially and psychologically, that's being imposed on these children to not be at school. So most definitely those with no symptoms, that's where they need to be. That's the safest place for them to be. And we really have looked at the data behind this and what our professionals here locally are saying to us and the feedback that we're getting. In addition to your feedback tonight, it's appreciated.
Yeah, I mean, I feel very comfortable with the changes. You know, we talked about this a lot on Monday, but, you know, I feel like, you know, we're still going to be doing the contact tracing. So that will, I feel very assured that with that piece here, that we will be able to identify the rates of children and staff testing positive if that's to occur, even with this policy change. I think that, I mean, we've talked about it. I had this experience personally. My high school son was quarantined for 10 days, or 14, but he missed 10 days of school. He's got 6 missing assignments right now, and he's got an F in 2 classes because of those missing assignments and missing tests. He feels the anxiety. He's not in sports or activities, so that's not a big deal for him, but it's just the fact that he's missing that classroom time and seeing those grades posted on Infinite Campus gives him anxiety. And it doesn't help when his parents are going, what's this F about? So we see that. I've seen that personally. I've talked with many friends of mine that have kids at varying levels and at all different schools. We've gotten a ton of feedback through emails, phone calls, let's talk. So this is not a decision we're making lightly. We have thought about this for a couple of weeks now because of the feedback that we've been getting from families and teachers alike. So I just would like to say that, again, this decision, this change in policy is not just something that we devised on Monday. Yes, we're trying to turn it quickly, but I think that's just because we want to make that impact on our kids sooner than later. So that's just where I stand.
I would just add that I have the unique perspective of being a healthcare provider as well, and I'm a nurse. And so I see what goes on at the hospital, and I see numbers that maybe the public doesn't necessarily see. And I also have kids. I have a high schooler who today was her first day back from being on quarantine. And so I have a different lens than some people. And so I think I just want people to think about the notification timeline. And this is by no fault of the school districts. This has to do with the Department of Health and resources and things like that. But my daughter, for example, and I think in talking to you guys, the same thing was true. She was exposed on a Wednesday, was notified on a Monday that she was exposed. And so then obviously her time started on Wednesday. But in talking, and I did some extra work, I went and talked to both an adult infectious disease physician at work as well as a pediatric, because like you said, we treat both populations, or we work with both populations of people. And both of them specifically said to me, students are most likely to be symptomatic and infected within the first 3 to 5 days of exposure. So for my daughter, she was at school for those higher risk days of her being exposed, also potentially exposing other people. She's a mask wearer, so she hopefully didn't to the other people who were. But so when I hear that, and I think we're not even getting to our students until the point that they may be already symptomatic, well, it's too late. They've already exposed other people. And so I read, we got many emails. I read every single one of them. I did not reply. I did not have time. But I assure you I read them. And I had a few people who said, well, why don't we do something more mild? Like, let's reduce the amount of time that they're on quarantine. And my argument to that is you're still at school for those most infective times because of the delay. And so I don't know that pulling a student out for one day and then sending them back the next in order to serve their quarantine time makes sense or isn't disruptive to that teacher and that student. And so I want to talk about that. Mental health, I think a lot of people have talked about that. And, just having a child sitting at home and that fear of missing out. They already missed out on 9 weeks of their school last quarter. And so now to think about having to miss out on anything, we all have homecoming, all these different activities at all levels of our school. And so our students don't want to miss out on that. And when they're at home, they're feeling the pressure, like Kate mentioned, of I have this missing assignment. I can't go to school because I can't take that test. And when I get back, we're already 3 units past that, but now I have to go back and test on that information because I was at home during that time. And so that mental health of that. And as somebody else mentioned, I do think that our current policy caters to students and families who have access to resources. And so I heard from many of you who said, I'm thankful that I have a job that allows me to take off to drive my kid to an event, whether it's a cross-country meet, a volleyball meet, because that 15-minute bus ride is enough to make my child not be able to go to school for 14 days, and that's not a risk I'm willing to take. And so if you think about students who don't have parents who have flexible jobs, or the resources to be able to do that, I think we are really putting the burden on some of our students and our families who already have burdens that they're carrying that we aren't able to help them with. And so those are some of the things that I just wanted to share. The other thing that as we talk about hospitalizations and things like that, I can tell you a fact that I found very interesting that was shared with us at the hospital is that if you compare the average age of patients who are hospitalized now to the average age of patients who are hospitalized during that April and May timeframe, currently they are 10 years older than they were at the beginning of this pandemic. And so as we look at the age of our students, and we look at the age of our teachers, I want to say it was 56 in the earlier, and now it's 66, decimal points, whatever. But if you think about the age of the staff and the students, yes, we do have older staff that are working, but a vast majority of our staff and obviously our students are of that younger age group that has a very, very low hospitalization rate. If they do get ill, they can maybe manage their symptoms from home doing some of the home monitoring that hospitals are offering, or they may just be mild enough that they have to stay home and rest and can come right back. And so I just feel like in order for us to help the whole child and not just the educational piece that we're in charge of, that this policy at this time makes sense. And that we do go back, at the end of October, if not before then, depending on what numbers. We know there's going to be a 14-day lag, but we go back and we say, now what? Let's compare September and October, and how did we do? And do we need to tweak something? And maybe it's this policy, and maybe it's something else that we need to look at too. But I just feel like this is in the best interest of the majority of our students and our teachers to help them to be able to manage their time. We want teachers to have time with their families too. And if they're at home doing 3 different lesson plans for the kids who are at home and the kids who are going to be coming back, and then the kids are in their classroom and they're trying to do all these different things, that's just more of a burden on them than if we can keep most of those kids in their classrooms and in those seats, then they can focus on those people and the small number of people who are out and that are positive. Thank you.
Thank you, Carly. I would just like to add that, we expected our students and staff to wear a mask. They showed up, they did it. It's been working. We're now encouraging and incentivizing, I think someone used that word, to continue that process because we know there's mask fatigue and we've heard of that, and we don't want that to occur in our district. And so by adopting this new quarantine rule, I think it will help the continuation. We need to be vigilant with our mask wearing. We need to make sure our students and staff are wearing it correctly. And this is a way that we can move forward on that. And once again, we might have to adapt again. And we will continue to look at policies throughout COVID. COVID sucks. I feel terrible for everyone, this additional work and load and everything, but it's not just staff here, it's staff in the entire city of Sioux Falls, it's school board members, it's everyone. And we just all need to be a little patient and just be willing to change when we need to change. And we got the data from Dr. Stephen on Monday night, and that's what made my decision and the rest of our board to make the directive to look at other surrounding communities and states to see what they're doing. Wyoming, Nebraska, Iowa, those are some surrounding states we know that are basically having the same plan that we're looking to go to. So we can also not just look at our district, we can look at how they're doing. Wyoming has a very good website on what they've studied at the last 6 weeks in their school districts as to what has happened in their schools with spread and so forth. So we can rely on that as well to help us make these decisions. Thank you very much. Any other questions or discussion?
I guess it's already all been said. But as I said on Monday, I think our job is to educate kids, and I think we're failing at that by keeping kids out for 14 days and maybe another 14 days. We're following some good protocol. We can always revert back. We can always evaluate this. So I just think this is a really good move for our students, our schools, and the public.
Thank you. Do I have a motion to approve the new adopted language on the quarantine for the Return to Learn plan?
So moved.
Second.
I have a motion by Board Member Baker, a second by Board Member Parker. All those in favor signify by saying aye.
Aye.
Aye. Opposed, same sign. Motion carries. Any other business for today to bring forward? Seeing none, do I have a motion for adjournment?
So moved.
Second.
I have a motion by Board Member Ryder, a second by Board Member Parker. All those in favor of adjournment signify by saying aye.
Aye.
Aye, opposed, same sign. We are adjourned.